Well, hello everyone. This is Dr. Mike Chua, physical therapist. Hey, today we've got a special guest who is all right, her name is Morgan Stone. We'll be back in a few seconds, okay? All right, we are back in our little Jerry Hab show. Hey, this is Michael. I'm a physical therapist, and we've got a special guest for today. Her name is Miss Morgan Stone. She's a nurse practitioner. Actually, I used to go to her when we were working at the hospital, right? And I reached out to her and I asked her, "Hey, Morgan, do you want to do this?" She started her own private practice. She has this. She's a family nurse practitioner for 15 years now. Imagine that. Yeah, I think I started when she graduated, and then she opened her own base functional medicine 2 years ago, 2023, and now offers different functional medicine about the mind, the therapy, got a massage therapy. I haven't been there yet, and the red light therapy. So without further ado, let's go and bring in Ms. Morgan Stone. Ms. Morgan, how are
Hey,
you doing? How's everything there in the neck of the wood there? So
I'm great. Thanks so much for having me. This is a real treat, and I'm sorry it's
Morgan,
taken so long
you,
to finally connect and do this.
I know, right? Well, we're all busy, but first of all, could you please tell us again who you are, what do you do, and what are we doing here?
Yeah. So, Morgan Stone, I'm a nurse practitioner, been one for 15 years, and I was in internal medicine and family practice for the first 8 years in Martin. And then I went to urology for 5 years. And then I just really stumbled on functional medicine in the midst of COVID and began to just kind of question everything I had ever been taught from a traditional medicine standpoint and discovered functional medicine. I said, okay, these are the people that think like I think. I'm a why person. And so functional medicine is just digging down to the root cause of why do you have the health issues that you have and really being very proactive on the health and wellness perspective instead of being reactive on once a problem starts. I was really frustrated and burnout in internal medicine, sitting across from patients saying, I hear you, I see you, I know you, something else is going on, but your labs are normal. And so let's just use this medication to treat the symptoms. So, yeah, functional medicine has given me a lot more tools in my toolbox to be able to dig deeper into lab work that I can glean information from, but then also to be able to do some specialty testing that was never available to me before. And so that's where I started. And then the Lord has just opened doors up in the midst of that. And so I left traditional medicine 2 years ago and opened up Cornerstone Whole Health 360 to be able to address the whole person. Um, and a cash-based practice because insurance makes the world go round, and so that dictates a lot of why we do what we do with our patients and our patient care. And so I wanted to be able to have the freedom to step outside of that to be able to do things. And so the Lord has blessed, and patients in rural Northwest Tennessee have been very open and welcoming and hungry for doing healthcare in a different way.
You know what? It's funny that you mentioned that. In the middle, you started this in the middle of crisis, right? So same thing with me. I got fired, and then in the middle of crisis lies an opportunity, ladies and gentlemen. If you're watching live, comment live. Watching on the replay, comment replay. But that's what happened to me too. Of course, Morgan, she could never be fired, but she started her
Oh
own
gosh.
pathway. I got fired. So I got fired, and I said, I have no choice. Either I go home or go home to the Philippines, get deported, or do it all over again. So I did it all over again. And then same thing with Morgan, ladies and gentlemen. If you really want to find your niche, or if you want to, get out of the traditional healthcare system, you have to start your own private practice, because you cannot do this if you're doing it under a big hospital system. Like me and Morgan, we used to work for the hospital, and it's hard, because you
It
have
is hard.
productivity and stuff. But if you do it on your own, you can tell your staff, you can tell yourself, okay, I'm going to see these patients for a full hour. I'm going to take care of them for a full hour. And that's what we do in Jerry Hab. We just really take care of them, the full hour. Yes, we don't have a lot of cash paying patients, but,
Yeah.
with Medicare, we have to really build them, 30
Yeah.
minutes or 8 minutes or the whole hour so we could get paid. So, Let's go back to functional medicine, Morgan. What is
Mhm.
functional medicine? I hear it all the time. I
Mhm.
know nurse practice. I know physicians who does this. Tell us
Mhm.
about this more.
So there's, I would say there's several different types. People do functional medicine in a couple of different ways, but the big broad picture is looking at your health from a root cause standpoint. Why do you have the health issues that you have? So I can have 10 different people in front of me with hypertension, but the cause of that hypertension can be very different for all 10 people. And so when we put in traditional medicine, when we put people in boxes and just say, okay, hey, you have high blood pressure, you need to do this, 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 and this from a prescription standpoint. Well, that's really not. It may be treating the blood pressure, but it's not addressing the root cause of why they have the blood pressure to begin with. Or for diabetes, so many things do come back to our diet and our lifestyle. But you know this in the traditional setting, you have a very short amount of time, 5-10 minutes with each patient, and you've got a productivity list of how many patients you're supposed to see a day, and to be able to spend the time that you need to with patients, to be able to go through and unpack their personal health story, and to say, okay, what are some pain points for you? Okay, why can you not eat this way? Or what are some areas where we can change and shift, instead of just saying, hey, you need to lose 15 pounds, go diet and exercise and come back in 3 months. And so being able to tailor a lifestyle plan with patients, and then also to be able to take a deeper look into their health and say, okay, hey, actually, maybe this issue is more related to you not having enough magnesium, or maybe there's a little bit of a genetic component, but we can work on your genetics and we can do some things, some very targeted supplementation to adjust to be able to help you to, for instance, methylate better so that your blood pressure can be improved. So when I talk with patients about functional medicine, kind of the foundational pillars are diet and nutrition. We can absolutely heal our bodies with food. It's just tough because our society and our world has made everything out of taste, convenience, quick and fast, and prioritized schedule over really mindfulness in the foods that we put in our body. There's a reason why those in Europe and the Mediterranean are healthier than we are, because they eat very different than we do. So diet, nutrition, exercise, and movement. You don't have to do CrossFit. You don't have to wear a sports bra and get super sweaty. You don't even have to join a gym, but you have to move your body. Our bodies were made for movement. And muscle is longevity. And then sleep management. If we are not sleeping right,
Why are you looking at me when you say movement?
um, and so sleep management, stress management, that is probably the biggest bucket, the hardest bucket to work on. I'm super guilty in that bucket because we live lives full of stress and go, 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 do, do, do. Sympathetic dominant nervous system lifestyles, but we want to have all of the things that are in a parasympathetic state, which is rest, digest, heal, repair, restore, libido, fertility. But we live a life that's very much in the fast lane, and our body says, wait a second, there's a disconnect here. And so it says, no, I'm fighting, fleeing, and hiding and freezing because we're being chased by a tiger all the time, whatever your life tiger is. And so sometimes we make our own life tigers, but other times there are things that are chasing us that we don't realize, and being able to work on that. Mental, spiritual health. So being able to really focus on mindfulness and your thoughts and the story that your brain tells your body. Your body will biochemically change based off of the thoughts and the interactions that you have from what's happening in your brain, and vice versa. And so then the last pillar is toxicity. And I usually, that's the last thing I get to with patients. It's not just pollution. Most people think, oh, toxins. I don't get any toxins. We live in a very toxic society. And again, there's a lot of reasons why in Europe people, they don't allow certain things in their foods or in their water or in their products. And so that toxic load builds up. And so we have to work on some of that. But that's usually the last thing that we work on. So diet, nutrition, exercise, sleep, stress, mental, spiritual health, and toxicity are kind of the pillars that I work through with patients with functional medicine.
Well, it's so funny you mentioned that. I feel like I kind of practice functional medicine because I preach
Mhm.
I talk about the nervous system all the
Mhm.
time. The sympathetic
Mhm.
upregulation and the parasympathetic nervous system. Just today, I have an evaluation right now, and I was palpating her muscles and everything, and she's in a kyphotic position, and I said, "Well, your neck is in a fight or flight mode. That's the reason why your blood pressure is high. That's why your kidney function is crazy, and then that's why your position is like this, because you are going to or flight mode. It's like, oh yeah, because it's stress, it's Christmas, you got everything, blood pressure's high, heart rate is high, and then you got this up regulation of your sympathetic nervous system. So with that being said, we I advocate for physical therapy. I would always tell them, hey, we need to relax, you need to do some breathing exercises, deep diaphragmatic breathing exercises and stuff like that.
Yeah.
Of course, we in physical therapy, we don't prescribe medicine because movement is medicine.
Yeah.
So in your case, do you do movement therapy there? You mentioned it. How about food? Do you serve food there, or I mean, how does
No.
that work? Because I met a functional medicine physician here. Oh gosh, she's gonna get mad. I forgot her name, but she actually
Cooks.
cooks
Yeah.
for the patient.
Yeah. So that's one of my long-term goals, to be
She
able to
has a
have.
program where she's just right here in the corner here. Okay, I forgot her name. Mhm.
Yeah. So that absolutely, I do not have in-house cooking. My husband is a master gardener, and so he grows quite a bit of our produce, and being it for patients who say, I need a good place to be able to get local things. But no, I do not have an in-house kitchen. That would be one of my long-term goals, is to be able to do that and to be able to offer hands-on cooking advice, because so many of us don't know how to cook, or we're not taught to cook. It was open a package and put it in the microwave and turn it on 2 minutes, and then your meal is done. But targeted nutrition counseling, and I'm not a dietitian, I'm not a nutritionist, and some people need much more than that. They need some very specific hand holding of really getting down to their macros and micros of exactly what they need. But being able to say, okay, hey, here are some meal plans, or here are some food recommendations of how can you shift your diet from a highly processed diet to a more whole foods diet, and being able just to go at a speed that the patient can work at. Because if someone's eating fast food 3 to 5 days a week and trying to switch over to having a whole foods diet, that's not going to happen overnight. And they have to have the meal planning prep and the food prep, and they have to have the motivation. And that is a huge part with functional medicine, is that the patient motivation side, and really the work being on the patient of, we can talk in a partnership of being able to decide, okay, hey, these are areas in your life that we can, you got to this point this way, and identify areas, but it's a matter of arming them with tools and resources to be able to go and implement those things. And they have to be motivated to do that. And so not everyone is a fit for functional medicine. And some people, but those that are motivated and committed to doing things differently than just convenience. And you made that comment too about, you already do a lot of functional medicine in your practice, because the other thing with functional medicine is we see the body as a whole, one connected system, and our bodies are divinely designed to work together in one system. And traditional medicine is not bad or wrong. It is great for acute care things, heart attacks and strokes, and in many areas. But when it comes to piecing out those specialists, we need cardiologists, we need orthopedic surgeons, but we have become so specialized that we've lost sight of the fact that the body does all work together. And so, yeah, in physical therapy, absolutely. Breath work and your movement and your blood pressure and kidney function, all of those things are all interwoven together.
It's so true. You are so true about what you said about, we have been so specialized that we've forgotten how to really take care of the whole body. You know. So again, thank you very much for answering the call, Morgan. Because many are called, but few are chosen, and very few are chosen ones who actually do this and see the patient as a whole. I just researched who the doctor that I interviewed, Dr. Kim Howerton. She is the functional medicine. She's last time I talked to her, she said she's learning how to cook and everything, actually serving it to her patient, because food is medicine too, ladies and gentlemen. If you're watching live,
food is medicine.
food
Yes,
is
food is
medicine,
medicine.
movement is medicine. So the more you eat healthy foods, the more you become healthy. You know what they say, whatever you eat you become, right? So
Yeah.
person, and I feel like I'm having some technical issues. I'm losing you a bit, or I'm losing myself here a bit. I would love to visit you someday there in your location, bring my little camera, see
Yeah.
what are the equipments so what are the services
Yeah.
that you guys provide there?
Yeah. So my functional medicine, I have a waiting list for functional medicine patients. And so that waiting list right now is probably about a year to a year and a half out, because I spend at least an hour with my
Wow.
patients most of the time. And so I don't see 30 patients a day, and I want to be able to spend the time that I need to with my patients. So besides functional medicine, I also offer IV therapy. So IV infusions for many different types of things, from energy standpoint, for metabolism, for immune system, for just general hydration, for performance and endurance for athletes, for mitochondrial energy, and vitamin C. So tailoring that for what the patient needs. And those are the services that I'm talking about now are ones that you don't have to be an established functional medicine patient to come in to get those services. And so IV therapy is great. And usually I can get people in that day or the next day, as long as I just have a little bit of heads up, because I'm still seeing patients in between there. But I also have I have Amanda who helps me with that as well. And then I do have a massage therapist. She's on maternity leave right now. And so she is a phenomenal massage therapist. She does prenatal massages and
No.
lymphatic massage. She does reflexology and cupping and all different types of techniques. And so she's phenomenal. I'm really missing her while she's out. She also has a red light panel that she will use with her massage therapy patients. But while she's out for seasonal affective disorder, for those that get the winter blues, we have patients that come and just lay under the red light for that. And then my two newest therapies that I added this year are Emsella and ExoMind. And Emsella, I think, is probably the most interesting to you from a dual purpose physical therapy standpoint. So Emsella is bladder pelvic floor therapy. So it is high frequency magnetic stimulation to the pelvic floor. So it's a chair that patients sit on. You don't have to get undressed. You keep your clothes on. And it provides magnetic energy to the muscles to provide a super maximal muscle contraction. And it's 28 minutes long. And it provides the equivalent of about 11,000 Kegels in that 28 minutes. It's not painful. And so they get to keep their
Wow.
clothes on, but to really strengthen the pelvic floor. And it engages all of the muscles in the pelvic floor. I'm a huge proponent of pelvic floor physical therapy before having children, after having children, immediately postpartum, in the perimenopausal period and the postmenopausal period. But I worked in urology for 5 years. And so overactive bladder, stress incontinence, the cough, laugh, sneeze, leakage, I was a big part of our overactive bladder program. And so being from the urology side and being able to, which is a highly surgical field, being able to address urinary issues with my functional medicine patients, I felt a little bit at a loss until I discovered Emsella. And so being able to mesh that. And so it is that everybody needs tailored a little bit different, but the main program is to do 6 sessions 2 times a week for 3 weeks in a row to get the pelvic floor in a better place. And so there are about 60% to 70% improvement in nocturia, getting up at night, in the cough, laugh, sneeze, leakage, 50% reduction in pads, the amount of pads that someone wears, and then being able to hold their urine longer. But then also from a prolapse standpoint, improvement in just the descent of the pelvic floor, of being able to tighten that back up for mild prolapse. So really phenomenal option for patients. And then it's also, so that's the female side, but then for males, also helping with erectile dysfunction. And then we forget about men sometimes when it comes to their urine control, because we address the prostate so much. But those that have prostate cancer and they have had prostatectomy surgery, they have usually pretty significant leakage afterwards. And so I have several patients who are post-prostatectomy that had significant incontinence and are now dry and not having to wear a pad from doing Emsella therapy. But then erectile dysfunction as well. So because we're doing muscle contractions and increasing blood flow, there's also increasing nerve endings. And so there's about a 37% improvement in erectile dysfunction for men, unrelated to prostate cancer, just men that struggle with erectile dysfunction as well. And then there's also the intimacy side for women, because we're increasing muscle strength, we're increasing blood flow. So there's some improvement for women, kind of as a secondary bonus on intimacy from an ability to achieve orgasm, strength of orgasm, and then also some women for just painful intercourse from a dryness standpoint. So really a lot of different options for Emsella across the board for the pelvic floor.
Amazing, amazing.
Yeah.
Well, let's go back to the MCL thing. So it's
Mhm.
non-invasive, ladies and
Uh-huh.
gentlemen, right?
You keep your
So, and
clothes
then
on.
you just sit down on the machine. Yeah, you have
Sit
your
down on a
clothes
chair. It looks
on.
like a
No,
giant toilet.
no penetration, no anything.
No
Just like
penetration. Yeah.
a little chair, and then you're sitting down there, and it has those electrical impulses and everything. So it's very good. So I think I have to use that too. So pelvic floor, I need some
It
pelvic
feels
floor
like
strengthening,
a
especially for
TENS
those people.
unit.
If you are sitting down all the mm-hmm.
Mhm.
So that's good. That's good. So they just sit down on it and then just relax, right?
Mhm.
And then can they
Yep.
do IV on it at the same time?
You actually can. My only hesitation is if someone already struggles with urine control, it doesn't make you have an accident while you're on the chair. I've never not had anyone have an issue with urine control, but if we're putting a liter of fluids in and you're sitting on that chair and you sit there, as long as you can hold your urine for 30 minutes, you're fine. But a lot of times I'll separate it
Mhm.
out and say get your IV after you do your Emsella treatment if you need an IV for some reason. I had a patient the other day.
Wow.
He was getting an immunity boost while he was doing his Emsella treatment. Yeah.
Amazing, amazing. Well, again, thank you very much, Morgan, for doing this.
Mhm.
This is such a needed service for not just for our community, but for every single one. Whether you're young, you're old, you're 15 years old, and 95 years, you need this therapy, the functional medicine, checking your whole body out. So again, Morgan, where can they find you? Where can they see you? And then
Mhm.
last
Yeah,
parting
so,
wisdom for our people.
so I'm in Martin, and our phone number is 731-599-2909. Most of the time it's gonna go to voicemail because 'cause we're with patients, and so you can leave a message or you can text the office number, and we can get back with you. You can go to the website, and you can also, send us a message through there. Amanda is usually who it'll get to, but I'm in Martin at 300 North Macomb Street. And we typically, if you just drop in to ask questions, we might be with patients. And so it's usually better to call so we can, if you have more questions about Emsella or ExoMind, and I didn't even really talk about ExoMind, or IV therapy for the services to get in relatively quickly for, we can schedule a Zoom or a time where I can break away and talk on the phone if we need to, and set up a quick consult time for that.
All right. Well, again, thank you very much, Morgan. Appreciate you. But before I let you go, ladies and gentlemen, always remember the word fast, FAST. Letter F. Find people that will bring out the best in you because you are the average of the 5 people you hang out with today. Hang out with Morgan. I feel like I want to go there now and have my, sit down on that MCL machine. And then, even then, before, ladies and gentlemen, I knew Morgan was the next level person. When I saw her back there working at the Volunteer Martin clinic, and I knew this lady was up to something that she will go up and beyond on her current practice.
Mhm.
Next level is letter A. Take action. All this stuff that we're doing is not going to do me good. It's not even going to do Morgan good if you don't take action. Take action by reaching out to her. Go to their website, Cornerstone Whole Health 360.com. Take action. Go call them. They may not answer the phone immediately because they're seeing patients. They're very busy. 1 year of wait. Oh gosh, that's amazing. So take action, right? Leave a voicemail, take a Zoom call with Miss Morgan. Next, letter S. Share, subscribe. The more the better. Share her website, share her face. She's got several educational materials there too. And last but not the least, here teach it. Why? Because when you see, you remember, but when you're teaching it, you're actually, and that's what Morgan is doing. She's teaching us how to understand functional medicine. Thank you very much. Be awesome, be great, be excellent, and we'll see you in the next episode of
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance